Meanwhile, South Korea is reporting an increase in coronavirus infections for 7 straight days. It's recorded more than 1,000 cases, mostly attributed to the Delta variant first identified in India. It's forced the government to impose its toughest restrictions yet. In the capital, Seoul, the center of the outbreak, nightclubs have been shut, new rules introduced in gyms, and private gatherings limited to 2 people after 6 p.m.
South Korea's latest COVID-19 wave has hit the country hard. The government has clamped down with new guidelines, including social distancing, that have especially affected small businesses. These for rent signs tell the story. In terms of the economic impact of the COVID-19 pandemic, no neighborhood in Seoul has been quite so stricken as Itaewon. This once bustling multicultural entertainment and shopping district suffered a cluster outbreak in May of 2020, infecting about 250 people and causing a significant drop in visitors and business. Myung-jong-man opened a cafe offering a variety of drinks and her own blend of coffee beans, just as the pandemic arrived in early 2020. Soon her business would really feel it.
My cafe is close to Itaewon, so last year's outbreak there affected our sales as well. We hardly saw any customers. It was like a ghost town here.
Since Monday, gatherings of more than 2 people, other than family, are banned after 6 p.m. in the capital, Seoul, where 80% of the new cases are located. Rule breakers of this and other restrictions face stiff penalties and fines.
We need to be very careful. We disinfect the store every couple of hours and disinfect tables meticulously after customers leave. We give out hand sanitizer and ask everyone to wear a mask, as well as register with a QR code.
South Korea has been praised for its early success against the virus, only to have cases linger and grow. Soon, harsher restrictions returned.
For me, as a business owner, I'm not happy about the new rules. But trying to reduce the number of daily confirmed cases by maintaining social distancing is better than more people getting infected.
At Yonsei Severance Hospital, Dr. Lee Hyuk-min oversees COVID-19 testing. He says the more infectious Delta variant now makes up more than 25% of South Korea's new cases.
If this Delta variant starts to spread in the general population, it will encounter other variants and create a new variant. If this continues, the virus would be able to create a variant that resists the vaccines. So we should try our best to prevent Delta from spreading further.
Just 11% of the South Korean population is fully vaccinated, and officials hope herd immunity will be achieved by November. The new guidelines are set to be in place for the next 2 weeks, at least.
And here's a few more updates on the coronavirus situation across Asia. A third wave of COVID-19 in India is inevitable and imminent, according to the Indian Medical Association. In a letter to government leaders, the IMA called for strict curbs on mass gatherings for 3 more months and ramped up vaccinations to mitigate the impact. The WHO Director General has said the world's vaccine disparity is driven by greed. He has urged drug makers to prioritize vaccines for poor countries rather than lobbying rich nations to buy booster shots. And in Thailand, health workers already vaccinated with 2 Chinese-made Sinovac jabs will now get an AstraZeneca booster. A study there has found that Sinovac was less effective in fighting the Delta variant. Now, that comes as Thailand imposes new restrictions in the midst of soaring cases. The numbers of deaths is also going up. And as we report, one temple in a suburb of Bangkok is struggling to keep up with the demand for cremations. It has also had to rethink the way it conducts its funeral services.
COVID-19 is changing everything, including death. These volunteers are doing their best to give this person a respectful send-off. But the risks of handling the body mean funeral services have to be quick. This is unusual in Thailand, where relatives traditionally spend days saying goodbye to their loved ones before they are cremated. The Buddhist ceremony held by monks at this temple for the family of the deceased also has to be much shorter than usual. But officials there say they're facing an extraordinary situation. In our areas, there are so many deaths, and we don't know if there will be more arriving today. Our crematorium isn't working well because it's overheated from the continued use. If we place the coffins inside, it will just burn without us pushing any buttons. Employees are working hard to keep up with the demand. Pairu Sutrup leads a foundation that offers funeral services for free for the less well off. He says they've managed to raise funds to build a new crematorium. But he's afraid of what is to come. We don't know what will happen next. My hope is that everyone will be cautious and try to avoid this disease as it destroys everything in its path. For now, it seems the deaths from COVID-19 in Thailand are likely to increase before the situation improves.